Hello there, and welcome to the second installment of our virtual learning series for spring 2014. I'm Mark Connor, Associate Provost and English Professor, and I'm joined today by Renee Pratt, Professor of Business. And Renee, you're teaching this really fascinating course this spring, Healthcare Information Systems. Can you tell us a bit about this class and what sorts of things you're doing in it?
Yes, definitely. Well, thank you first for having me. I'm really excited to be here to talk about my course. So as you said, I'm teaching a health information technology on ventures and technologies. And so basically what the course is, it's kind of a snapshot view of what's going on in healthcare today, in particular looking at electronic health records. And so, the United States is in this massive transition right now to change from having a paper-based system to now really going completely electronic. And what does that actually mean? And our students are going to be, a lot of them right now are going to be working for health companies or consulting firms who are giving advice to health companies and corporations. And so this is an opportunity to really give them an eye view, right into what's going on. In particular, also what I've had is I do have some pre-med students as well and some computer science majors who are also in the course. And so it'll give them a chance not only to see the business perspective, but also to see what's going on behind the scenes and how to use the technologies that are out there.
Wow, so computer science students who will be kind of on the back end of these technology systems, right. Pre-med students will be on the receiving end, right, having to actually work them. Right. Tell me what kind of attitude our students bring to this sort of course. What are some of the concerns they have about healthcare information systems?
Well, I think it's interesting. I expected to have a lot of different opinions, especially with what's going on, real world scenarios. But what I've really noticed is that many of them don't have a complete picture of what's going on. And so they come in with this idea of, teach me, tell me everything there is to know about healthcare information systems. And so it's a really good open discussion and dialogue. And so they're getting an opportunity to kind of look to see what's happening, what their parents are saying, what family members. I've had the opportunity of having an independent study this past semester who was also kind of going through some of the actions that the healthcare information systems class will be doing. And so kind of getting a view of, well, once he has spoken to aunts and uncles who are physicians and other practitioners, that's kind of what you're seeing is that they're all talking to individuals that they know who are in the field and trying to do some comparison and figure out, well, how does it fit and what does it mean to have electronic healthcare records.
Okay. So. Tell us, what are two or three of the major themes or topics that you all are going to pursue in the course?
So initially when we the first week of class, we actually focus on the healthcare market and kind of just getting them affiliated with terminology, understanding what happens in a physician's office, in a hospital, how does it differ, and so just kind of getting a general understanding of what the healthcare environment is like. And then from there, we really focus in on electronic health record systems. And so we talk about EHRs and what an EHR is and looking to see, okay, well, how do we implement it? How do we adopt it? Do we need it? Why do we need it? And so just kind of understanding from the perspective of maybe a small physician's office, why am I having to convert? And do I have to? And why do I have to? So we also focus on some of the laws. And so meaningful use, which is the kind of has come out of high tech and looking to see exactly what are the rules and stages and regulations for these certified systems. And so, so understanding what it means to have a certified system, as well as looking to see are there other options and where we're going forward. And then finally, towards the end, we kind of focus much more on the entrepreneurial side. And so now that you've had an opportunity to see what the healthcare environment looks like, what electronic health record systems do and how they interact with the physicians and the patients, and now, well, what can we do? Can we create things that are going to be either patient-centered or physician-centered or even hospital-bound or organization-based?
Right, because the course is, after all, a business course.
Exactly.
Right?
Exactly.
So how does that focus your concerns in ways that, let's say, a medical ethics class might be differently focused?
So the focus really in this case is to understand how the usage and behavior of the system. Right? And so from the business perspective, what they're getting is they're seeing how physicians interact with the technology and knowing whether it's something that the physicians are having, problems with, or is it easy to use? What kind of interaction are you seeing between the physician and the patient? Are they communicating as much as they used to? Is information being transferred in the manner that it should be? And so from the business perspective, the students are getting an opportunity to see, here are some unique areas in which I can actually contribute. And so one of the things that I've found having created this class is talking to some of our alums actually. And several of our alums, especially some of our young alums, have gone off to work for healthcare technology companies or have become entrepreneurs themselves and have developed healthcare technology companies. And they're really talking about how there's so many different opportunities to enter the market and to say, okay, well, I want to create something that helps monitor patient activity. And so every time a patient goes exercising, goes to work out, every time they visit the doctor, they're collecting all of this information and transferring it to the physician's office and starting to take care of maybe more so preempt some of those possible difficulties, diagnoses that may occur with the patient. Okay. And so they're seeing multiple areas in which they can really look at, and you're focusing on, like I said, either patient-centered or it might be on the physician side. A lot of physicians and nurses are complaining about how they interact with the technology. And so one of the things the students get to do is actually lab exercises in which they work with electronic health record systems. And so they see what it's like to enter a patient's information. And
wow, so really hands-on.
So really hands-on, if I ask for labs, and so they get to see images and see how does that come up and what the process is. So from the moment you walk in the physician's office to the moment you leave, collecting labs, documenting patient information, and recording. And so how that actually works, they get to actually test it with the system itself and see, oh, this is actually it's easy or it's clunky or, and kind of see where the problems are and as well as where the successes are.
That seems like such great training because so often you hear about somebody, they'll create something in the lab or in the office, but then when it gets into the real world, it doesn't work at all, or it's got all kinds of blocks to it or something.
Exactly, no, definitely, and I think that's one of the key things. So part of my course is that they do a workflow process project. And the reason they do this is because it's absolutely critical to understand, whether you're on the business side or the computer side, how a physician's office works. And so part of it, the first thing they do after we've kind of gone over some examples of what a workflow process is they actually visit physician offices locally here or within nearby cities and kind of hang out with the physician for a day. They usually work with a super user, one of the administrators, and so they get to sit at the front desk, see when the patient comes in, has an opportunity to actually see when do you enter information into the electronic system. And how does that information transfer beyond that? And so once the patient goes into a room and the physician has gone to see the patient, how do they collect information? Now, of course, for security purposes, we don't have the students actually sit with the patients. Right. And they do sign non-disclosure acts for just in case they do happen to come across any patient information. But they will stay mostly in the main office and just kind of talk with the physicians, the nurses, and administration staff there to find out how do they interact and how does information share. And it's amazing some of the things they'll find and see. Having moved to an electronic system, many places don't have what we call a complete electronic health record system. And so a complete electronic healthcare system is one vendor system throughout the facility. Usually you have multiple electronic computer systems that are from different vendors and are communicating with each other. And so because of that, you have a lot of disconnect. And a lot of times, so you'll have billing is handled by one system and patient information and documentation is handled by another. Well, in order to share that information, it requires the individual to actually print it out and either fax it to the billing office or in some other way, email it, PDF, something to that effect. And so the students get a chance to see that and really realize that, oh, it's not a smooth transition, right? And so, so what they do is they actually build a workflow process based on what is currently going on in that facility. And so from the as I said, from the moment they walk in the window to all the way till they come back out. And what they're looking for is to see where are the bottlenecks in this process and where can we improve the process.
Right.
And so they'll draw the as-is process, and then they'll come back and then they'll think about, well, where can we make some changes? Are there some things we can do? So for example, some facilities are too small to have an actual, what they call a cow, which is where the actual computer sits in your patient room. And so if there's not enough room there, they'll either have to carry a laptop or a tablet with them.
Right.
And some places will actually move it around on a tray. And so they'll look to see, well, are there ways we can improve that? So if they can't fit one into the actual patient room, maybe we should suggest that they have laptops or tablets. And what does that actually require?
Right.
And so beyond just saying, oh, I want to implement a tablet into your system, they actually get to learn the operating system, how it communicates with the system, so that if it is that their vendor currently does not actually offer that particular feature, then, okay, well, what vendor does and which one allows communication between the two systems, because that's important. A lot of times, many of our systems today don't actually communicate or talk to each other.
Right.
So.
And of course, if you change one part of the system, you're pulling on all those spider threads, aren't you?
Exactly,
You know,
exactly.
You may go to a different system and, oh, they can't work with their prescription system or something like that, or they can't do referrals, or it's all these interlocked systems of communication, isn't it?
Right, yeah, exactly. And it's also understanding when they leave that actual office, because a lot of physician offices communicate with the large hospitals in the area. And so there is a requirement to some extent that, you know, they can share information and communicate in certain manners. And so it can also unravel in that respect as well if they're not careful.
Right.
So.
And of course, this transfers to any kind of business system. I mean, it sounds like a university in a lot of ways, right? All these different information needs, all these different systems.
Right.
So they're learning one aspect of this, right? But it transfers to so many different things.
Exactly. So a lot of this, and actually even where I started getting into healthcare research, is that it was enterprise systems. And so enterprise systems are really the foundation of your electronic health record systems. And so they're large systems that manage multiple functional areas within the organization. And so, so when you branch off into particular industries, there is that fundamental common ground, right? And so how we actually implement a system, how we have, we manage the project, steering committees, things of those natures are generic across many of the systems. But there are differences in particular, and that's hopefully what some of that is, beyond just getting the general business aspects, they'll also notice, oh, well, we're in healthcare, which is a very dynamic and changing environment, which is very different than some of our other industries, manufacturing. Right now, I usually say finance or business a lot of times. Banking in particular are similar to the healthcare, at least, because you do have a lot of dynamic and changing if you're dealing with stock markets and so forth.
Very interesting.
Yeah.
This relationship between the physician and the patient, right? I mean, that's one of the things that's really had a lot of pressure put upon it by the new technologies, isn't it? And
Yes.
you know, suddenly the doctor, instead of talking to you, is, well, wait, I got to get this into the system. They may have the tablet or the laptop, as you said.
Right.
And I've heard a number of physicians say it's really become a challenge to connect with the patient when they're also having to relate through the technology.
Right.
What kind of things have you found in your research with that, and what sorts of things will the students encounter in that area?
Well, I think you're definitely correct, right? So it is a transition period in learning how to interact with the patient and manage information and technology. And so some of that is being handled by putting that up front. And so what you're going to start seeing is a lot more of facilities are going to ask you to enter information before you get to the doctor's office, right? And in hopes to minimize some of that. And so normally, you know, when you go to the doctor's office, a lot of times nowadays they have you fill out a form, right? So now they're sending that form ahead of time to you, either by paper or electronically format. Many of them have built what we call patient portals now. And so the patient portal allows you to enter all your basic information, where you live, any allergies, previous surgeries, any of that information. And so that's helping to at least minimize some of that interaction as far as being lost between the patient and the physician. A lot of other places, if you are a large enough facility, you can afford to have both the nurse and the physician in the office at the same time, in which they'll have an administrative assistant or staff to help enter the information so the physician can continue just having a conversation with the patient. When you're not lucky enough to have that, unfortunately, you do still have to use the tablet, and you just have to monitor your abilities to look at the patient and enter information at the same time. And there are actually programs out there. I've talked to a number of nurses here in town who are talking about UVA having a program as well, and as well as I know some other universities are, in which they are focusing on sort of teaching physicians how to interact with the patient. And so they're actually having actors pretend that they have diagnoses, and then come in and the physicians get a chance to kind of interact and figure out, am I looking at you enough? Am I talking to you enough as I'm collecting the information? And so it's a transition and it's a learning process, but I don't think it's more of a matter of people don't like to change, right? And change is a hard factor. And you still had to collect this information via pen and paper before, so.
Right. The technology has changed.
The technology has changed.
The challenge has always been there in a way.
Exactly, exactly. And so I think that's one thing. What you also are seeing is, hopefully, by collecting this information on site, you're getting better accuracy of the data. And so that's really one of the big improvements about having an electronic health record system is the quality of information that's being entered. Because it's required based on that you enter that information when you're actually with the patient, you are more likely to actually get more information than waiting till, after you've seen the patient and actually writing down the reports. Many times physicians are busy, and so they don't get to write them immediately after, and so you may see 2 or 3 patients before you get back to the chart and have to do recollection of, okay, what did they say? Let me write this down. And so I think that's one of the benefits as well. So you'll definitely see some interesting aspects. So far I know I've had one student who saw in their visit Post-it notes being used as an option. Not necessarily a good thing, but physicians will just quickly write it on a Post-it note or in the corner of the file, and then run outside and enter it in. And so therefore, at least it kind of removes some of that. Yeah.
Yeah, that's very interesting. So that's one of the real gains, right? Of this, that the information is consistent. It can be shared easily among different healthcare providers. That sort of thing. One of the big concerns, of course, is privacy, right? Keeping this information private. And I suppose people fear, it's just being sent all over the stratosphere, right, through the internet. And if they can hack into the Target credit card system, what's to stop them from getting all that? So how do those issues of privacy fold into the course?
So definitely it folds fairly in the sense of where we're looking about HIPAA, for example. And so we will talk about the different rules and regulations that are in place for your data and quality of data. And part of the electronic health record system is that you're actually having to follow a certain set of rules, right? And these rules have been set by Meaningful Use and the HITECH Act, which define exactly how that data needs to be collected, how it needs to, how it needs to be collected, and then also just kind of figuring out what exactly that information is and who does that information belong to. And I think that's where a big question is right now too, is who does that information belong to? So when we're talking about it in class, we talk about who has access and rights to information. And so understanding that everyone doesn't have access to your data. So a patient file can only be accessed by the individuals who are allowed to view and speak with that patient. So you're talking about the physician on hand, the nurses that are dealing with that particular patient. They don't also have access to all information. They only have access to information that is specific to their duty or job to you. So that also helps to minimize some of that. But more importantly too, it's an understanding of if you really want your information, if you want to be assisted, if you want to be helped, right, you want the hospital and the physician to know what's wrong. And I think that's one of the hard things that we have the scare tactic of, oh my gosh, everyone is going to have access to this data. If someone hacks into the national database, there's going to be massive leaks of information. And it doesn't quite exactly work in that manner. First of all, most of the information, once you have visited the physician's office and moved on, and maybe you only go see them once a year, your information is actually attached to a particular identification number. And so when it's actually entered into the database and it's sitting on the database system, your number 1234, right? And so it needs the connection to understand that 1234 is Mark Connor. That in order to do that. So there needs a two-step process. And so, if the concern about being able to hack into a database and actually gather information, they might be able to access information such as what the patient was diagnosed with, what kinds of medicines they were given, but they won't be able to necessarily tie that information to the exact individual without accessing a different database.
And of course, in so many ways, the information is far more secure than it used to be, right? I mean, it used to be in a way, whoever could just pull that paper file out could see everything.
Right.
And now you've got levels of access, password protection, encryption, et cetera.
Exactly. And I think it's important to understand, individuals tend to think that, oh, well, it was safer before. And I was like, it's in a file cabinet. Anyone who has access to that door can go in there and pull information, right? And so there are many more levels of security in the process. And so I think, I don't think it should not be as much of a concern as it is, in the sense of, anyone can access my information. Anyone can't access your information, but we do need to figure out exactly how we're going to manage that information.
Right.
And so if we are going to have a national database, is it going to be a centralized system that maintains everyone's information? Or is it possible that we can manage some form in which we kind of have databases scattered throughout, in which there's some information in one location and more information in another location? And I think they're looking at that, and that's more for the security buffs out there who, but yeah, so they'll get a chance to at least kind of understand what the HIPAA laws are saying and what that means to at least keep your information private versus being secure. And there are differences between privacy versus security.
Okay.
Yeah.
Well, you've got a lot of stuff going on in this course. Tell us about some of the assignments you've got the students doing, how the students are going to be grappling with the course material.
Right. So basically what we're doing, so as I mentioned, they do a workflow process project in which they're going to manage that, what's happening in a physician's office. And then, but even more so beyond that, during the week, the everyday meeting of class, then we actually focus on cases and what's happening out there in the real world. And so I have them go to websites that are currently maintaining information about what's happening currently and what does it mean. And then we have discussions on what's happening out there. We also focus on some cases in particular. And so we look at different cases of hospitals that have been going on, what it's been like for them to implement and adopt information systems, and how has that changed the process. So we focus on having those kinds of conversations. I am a firm believer that people learn differently. And so it's not just a lecture, it's not just a discussion, but we also do lab assignments, and so they get their hands dirty and see what an electronic health record system looks like. We also have games in the class in which they'll be competing to put systems in the right order and adopt them properly. And then also having some guest lecturers and having individuals come in. And so what I've done actually this past week, we had my independent study from this past semester come in and give a talk about his experience of visiting the physician's office and what that was like and what he found. And so that kind of gave them some insight into exactly what the workflow process project was going to look like. Then beyond that, they're doing an entrepreneurial project. And so an entrepreneurial project is going to encompass a small, what we call a scene guild, and it's basically just a short business plan. It's maybe about 10 pages long. It gets them to look at the market, see what's happening in the healthcare market, decide costs, and what exactly they need in order to implement a new technology or a new system or a new process that they think would be beneficial to other healthcare providers. And so, so we go through those examples, and they get a chance to kind of learn SWOT analysis and looking at financials and how do we see the costs and benefits of implementing technology. And I think that's one of the bigger questions that we have today. A lot of when I came back this past year, I gave a talk to some of our board of advisors, and they hit me with the questions of, okay, well, how are we going to actually show that we're making a profit? How can you show revenue from and having this technology system? And so I think teaching them how important it is to be able to demonstrate that there is some kind of financial benefit, but that financial benefit isn't the only option. There's operational and there's clinical aspects, and so trying to see what those factors are in place. And so they'll develop their business plan, and then on the last day we have what we call Shark Tank Day.
Shark Tank Day.
Yes.
That sounds good. Tell us about that.
Shark Tank Day is basically a day where they have an opportunity to display exactly what their technology is going to do and what they want to enter the new healthcare market with. And so it's based off of the television show. So if you've ever seen the television show, right? And so you have 4 venture capitalists who are there willing to provide funds if you have a good product. And so that's exactly what's going to happen. And so they're going to do 2-minute videos to kind of give sort of like a commercial in a sense of what their product is about. And then they'll have an opportunity to stand in front of the venture capitalists, which are going to be visitors coming from the industry. So it'll be healthcare industry as well as actual venture capitalists, corporate analysts who have been in the field and know what it is to implement a new business. And they will have a fake amount of money in order to invest and give each student an opportunity to really kind of tell them what their product is about, how much it's going to cost, and kind of really answer some of the questions of, well, is this going to work? Is this a viable business opportunity? And so looking to see, is that really a viable business opportunity? And so we'll have some alums as well, hopefully come back and be able to talk to them.
Yeah, I wanted to ask how you're going to populate that panel. Who do you draw upon for that?
So I've been in touch. So part of actually, oddly enough, before this course, I'm also the university liaison between ourselves and Cerner, which is one of our They hire several of our students. They've hired several of our students in healthcare, and so they particularly develop a system called Millennium, which is a healthcare EHR system. And so what we're trying to do is get some individuals from like Cerner and Epic and some of these other industry vendors who can really say, this is something that we would really want and we'd be interested in. And so we'll have some vendors in place. We'll also have, as I mentioned, some alums who have actually implemented technology systems and started their own healthcare businesses. We have a number of alums who have actually gotten into that, and like I said, it's a hot button area right now, and everyone's getting into healthcare, and there's so many areas in which you can get into it. I'll also have 2 visiting faculty who are coming from other universities who I've worked with, who also specialize in healthcare research, and they focus mainly on one individual focuses on ecosystems and kind of the impact of behaviors and outcomes that are coming from external areas. And the other professor actually works with physicians and teaches them how to basically how to start new entrepreneurial ventures in healthcare.
Wow, what a great lineup.
So yeah,
you're not getting Mark Cuban, but still, it's
it's still a good
probably
lineup.
More appropriate. These people know more about the area than he would, I suspect.
Yes. So we are fortunate. I'm very happy that we were able to do that. We'll actually have 2 guest speakers in the semester. Next week we'll have Mac Davis from Epic. He's also an alum from WNL. He graduated in class of 2012, and he's going to come and talk to students about implementation in electronic health record systems and what exactly it means for the industry going forward, the future of it. And then the following week we'll have a professor from the University of Tennessee, Randy Bradley, and he will talk about HIMSS and kind of the different stages and what does meaningful use mean as far as what that certification requirements are for our system. So.
What a great culminating project, right? I mean, it really does take all the different facets of the course, and then they've got to put it together and kind of put it out there in the marketplace, in effect.
Yes, yes. So I'm looking forward to it. You know, my goal really at the end of the day was to be able for them to be able to have a conversation and to truly understand what it is that they're saying and talking about in healthcare. And so when they go home and they're with their parents and the news comes on and there's some information about healthcare, you know, they can say, oh, well, you know, this is why this is like this. I know something about this, you know.
Yes.
I do predicate, you know, I do preface at the beginning of class that there are lots of different topics going on out there and obviously government-based, and that we will talk about them, but specifically from an objective perspective. I try to stay away from the fact of whether it's Republicans or Democrats or who's behind what. That's not the goal of the course. The goal of the course is really to truly understand how technology is going to move the healthcare industry forward, and what that means and what future we have with that.
Right,
So.
right. Because of course, if they do go out into that real world, it's not going to be one constituency or one audience, right? They've got to learn how to work with the whole array of things.
Exactly, exactly.
Now, we talk a lot at the university these days about that skill that students need of making the oral presentation, making the pitch, being able to finish a project and then present it.
Right.
What sorts of things do you do, even in the short 4 weeks of the spring term, to kind of train the students, prepare them for that kind of work?
Right, so basically during the course of the actual course, we're actually going through and I'll have them give presentations, short, 5-minute, 10-minute presentations. So for example, the first day of class, I sent them each off, they selected a random word, EHR, HIE, different terminologies within healthcare, and I sent them off to the library for about 20 minutes to go research, find out as much as you can about this particular topic in a short period, and come back and give me a quick 5-minute presentation that just gives a quick overview. So we'll do things like that to help them practice, presenting and being ready and prepared for Shark Day, Shark Tank Day.
Right.
And so we'll do different things like that in which they'll really get a chance to communicate. We'll also have small conversations in which I break them into groups of 4, in which I'll give them a question and they are to be able to try to discuss it as detailed as they possibly can. Why does this system work? Why does it not work? What fell through with the steering committee? Things of, so just giving general questions and seeing how well they can communicate and ask these questions. And then we have a quiz here and there just to make sure that they're grasping the material, right? Making sure. So those are different ways in which at least to kind of help prepare them to feel confident in knowing the information and knowledge, and feeling a little more comfortable talking in front of individuals, right? And so I think the more they can feel confident that they actually understand what's happening and the material that's there, the better you can give a presentation, right? So, if you feel as though you're the person who knows that information, you're the expert on that topic, you're going to give a great presentation.
Easier. That's right.
Exactly.
That's right. Yeah.
Exactly.
Now this is being taught in our spring term, right? So 4 weeks, intensive course.
Yes.
The students are taking your course and nothing else. How does that affect the way you approach the course? What can you do in this course in the spring term that maybe it'd be more difficult to do in a long 12-week term?
Right. So in the 4-week term, because I do have them to myself in a sense, right? I do basically it really gives them an opportunity to get deeper into the topic. And so we can really focus in on different materials. I can give them several books to read at a time to focus in on information. They're able to go visit these facilities, for example, and actually see what's happening. Sometimes it's not as easy throughout the semester to have such options, but it can be done, but sometimes it's just not as easy. But by having them actually go in and see, they're able to spend large amount of hours focusing on what an electronic health record system looks like. They can really play around with the system, they can see how it works, and then they have the opportunity to kind of visit facilities and talk to them. We're also planning a visitation to a hospital so they can all see the difference between a small physician's office versus what happens in a hospital. And so this is an opportunity too as well, and where I'm able to get several individuals to come and talk from different areas within the hospital and say, well, this is why we like the system, or this is why we don't like the system. And so this really gives them an opportunity to kind of focus in on a particular topic. When being healthcare has such a broad range of topics, having them focus for 4 weeks on nothing but this topic really ensures that they know exactly what's happening and what's going on.
Right.
So,
Okay.
yeah.
Now, of course, this is such a current topic, as you're saying,
Yes.
such a hot button topic, and there's been so much in the news with the last couple of years with Obamacare and the website and this
Right.
collection of data and information. How much, I guess sort of two questions, how much does that kind of fit into the course as you teach it? And kind of what are your thoughts then, since you're kind of working in this field? What's your take on the president system and how that's progressing?
Okay, so first off, the way it fits into the course is hopefully by giving them foundational information about what healthcare technology is, they're able to have conversation and ask me questions about what's currently going on.
Mm-hmm.
And so, as I mentioned before, we have the moments where I'll give them articles in which they can kind of look to see, okay, well, here's what's currently, this is what happened today, you know? What does this mean for us? And how did we apply that? And so kind of that, as far as the course is going on, they just get a better understanding of when you're starting to spout off terminologies,
Mm-hmm.
you know, and there's like, oh, well, the EHR, and we need to focus on interoperability, and you know, what is interoperability? Why,
Right.
you know, why does it matter so much? And so they really kind of just get a better understanding of what it means.
Mm-hmm.
As far as what's currently going on in the system, I mean, it's an interesting area. Because there are so many areas, so many things to talk about in that perspective. And in particular, I focus on the implementation of EHRs and how that's going to work long term. And so I focus on what we call post-adoption usage. And so now that the systems are in place, you know, do they work well? And do they function in the manner that they should? And so this is actually a key aspect because right now, we are focused, 2014, 2015, the Department of Health and Human Services has defined that interoperability is our focus. And so what this means in particular is that the systems no longer have to just function in the physician's office or in the hospital, but they need to talk to each other.
Okay.
And this is, you know, I think this is an area in which when we talk to the students, I tell them, I'm like, you understand this is a business world, right? And we're here to make money. And vendors want to make money. And so there are reasons behind the fact that these systems don't communicate with each other and haven't in the past. And haven't needed to until now because of our new meaningful use stage requirements. They state there must be interoperability in a certified EHR system. And so in order to do that, we have to start figuring out ways, how are they going to communicate? Because we don't want this to only be something that's happening in the United States, but this is something we're going to share information. If you travel to Europe, if you travel to Africa, if you travel to any other countries, you want to be able to have your information come with you. And so how do you do that? How do we make sure that we create standards that are going to move forward? And so this initial process of the Obamacare, setting up the electronic healthcare system, that is just the beginning. We are only on the edge of that and trying to figure out how these systems work. I think we're at a stage now where they're starting to finally get the system underway as far as billing and insurance and figuring out, well, which insurance do you need? And there's a whole nother industry on that perspective. And so I won't go into that. but I do think we are finally moving in the right direction as far as electronic healthcare and making sure the systems are working properly and functioning correctly. And our focus really does need at this point to be on standardization, interoperability of the systems. And so, what exactly is it required for the systems, not only here in the United States, but systems across? And there is a huge group right now trying to do the EU-US Cooperative Act and trying to figure out how do we set some standards across, because the rules and regulations in Europe, for example, you have 27 countries as part of the EU, and they all do healthcare just a little bit differently. So we have to create standards not only just amongst US and EU, but it's amongst all the countries within the EU, and then you add in other additional countries, as they get further along, thinking about those processes. And so I think our big areas, not only interoperability, standardization, also then looking at for developing countries and how do we actually provide electronic healthcare systems for these countries. One thing many people, the big thing that we're complaining about are costs and how much these systems cost.
Right.
And we're not seeing the benefits from the system. And the reality is that yes, they cost a lot of money. But you do find benefits. The current benefits today are more going to be on quality and patient care, seeing the mortality rates go down, seeing medical errors be reduced. These are the kinds of things that you're going to see currently. In the next 15 years, that's when you'll start to really see necessarily more revenue generating types of benefits. Not that you can't see it, there are several hospitals that are starting to see some revenue benefits now, but it takes time. These systems have to be implemented correctly. Individuals have to actually enter all the data, which is another issue that we have. So there are lots of areas for us to be focusing on, to look at, both internationally as well as nationally. And so I think our focus at this point is trying to figure out how do we just get the system working and running correctly, meeting all the stages and processes, because there's a small percentage of facilities and hospitals that are on board, that are completely on board right now. It's a very small percentage. And so trying to make that on a national level where we can honestly say all hospitals, all medical facilities, clinicians are electronic, that's going to take some time. And I think that's kind of one of the benefits of the government and having defined specific timelines. We're forcing the system, the healthcare, to move forward. We didn't do it before, and it's not because healthcare couldn't have done it before, but they chose not to for one reason or another, depending on cost or long-term benefits, or just even the amount of data and information that we are collecting. It's just a different environment. And so we hadn't moved that before. But now with deadlines and regulations of by 2015, if facilities have not begun the process of moving to meaningful use in stage 1, they're going to be fined. And so now it's going to cost you regardless of whether you do it or you don't do it. By 2017, meaningful use funds will cease to exist, in the sense that they are not going to be giving more funding out. So you're going to be penalized in the sense of now it's going to come out of your own pocket truly if you're able to even benefit from those funds. And I think there's a lot of concern too, as well as focusing on facilities that don't offer maybe Medicare and Medicaid, and so they're not benefiting necessarily from what's being given by the government. And so they have to figure out other ways into understanding this. And I think that's one of the other things too, is where if we can start to see other opportunities for whether it be developing countries, whether it be other types of facilities that don't offer Medicare or Medicaid, how can we help them to also implement systems that are going to work for them and be cost efficient?
Okay.
So.
Well, it's really intriguing to think about not just where we've been and where we're at, but then where we're going.
Right.
And of course, for students learning this material, I mean, that's really the focus, isn't it? Is the future investment in all of these technologies. Can you just kind of speculate a little bit about what in the next 5 years, what we're going to see in this whole field, and what are some of the exciting ventures we can look forward to?
Sure. So over the next 5 years, I think there's going to be a huge focus right now on patient-centered care. And so the patient portal concept and trying to figure out how are ways in which we can really get patients to provide information that they wouldn't normally provide. Not waiting to just provide information when they go to the doctor's office, but to provide it throughout the year. So, nowadays a lot of our healthcare and insurance ask you to enter when you go exercise, if you quit smoking, any kind of information like that in which they can help to start doing preventive care. So you're going to see a fair amount of that. You're going to see some movement in technology for senior healthcare. And so in particular, how do we provide home care for seniors through the use of technology? And so you'll probably see a lot of businesses popping up in which they kind of monitor seniors through a wrist technology or something to that nature, and then when something goes wrong, they're able to automatically contact them, send someone over, speak to them. And so the risk monitors will manage things like blood pressure, different other types of information that might be collected. And so you'll start to see some things like that. You'll also see a lot more technology, and this we've already started to see, but you're going to see some more technology with physicians and nurses and individuals who are having to enter data. And so scripting, scribing formats, how do we collect data so that we can have much more physician interaction with the patients. So voiceover and so forth. So you'll see some technologies in that as well. And then again, just kind of improvement on electronic health record systems. And so looking at EHRs, how do we move to, we'll see a lot more changes in infrastructure. And so today we have usually one database, a major central database that the system runs from, but we'll be moving to modular formats as well as even what we call a hybrid format. And so the hybrids we already hear in hospitals having what we call private clouds. And so looking at the different infrastructures that are in place to actually improve the technology and the usage of the technology long term. So I think those are going to be like your main areas. And like I said, interoperability, making sure that you see connection and communication between vendors. This is the market that actually I've spoken to a couple times to entrepreneurial markets last year about where to enter, and one of the areas really is small and medium-sized hospitals and facilities that need to share information with other facilities. So you're going to see a lot of small businesses crop up that are going to be consulting and providing small EHRs that communicate with the larger systems. And so middleware, for lack of better terminology.
So then the challenge for that cluster is how to convince the hospitals, the doctor's offices, et cetera, to buy into their product, integrate it to what they have, and so forth.
Right.
And so that final assignment where the students have to come up with the pitch, right, have to come up with the plan, that really gets to where the rubber meets the road, from the business perspective at least, right, in this whole area.
Right, exactly. So they're really going to get a chance once they've come up with the business plan and figured out exactly what the system or technology is that they're doing. They'll really determine, is this something that I could implement over the next 5 years? And how will I do that? And who do I need to speak with? And what vendors do I need to talk to? And how many computer techs do I need on staff to develop this? And so they'll really get a chance to kind of understand this process.
And dive into the Shark Tank.
Dive into the Shark Tank.
Great.
That's right.
Well, I tell you, Renee, it sounds like a great course.
Great.
Yeah, it sounds really exciting. Look forward to learning more about how it all unfolds for you.
Definitely. Thank you. Thank you
right.
again.
Thank you, and thank you for joining us today.